Audible, sir.
Audible, sir.
Hello. Hello. Is this audible, sir? Hello.
हेलो दे दे रन दे ये दे हेलो एम आई ऑडिबल हेलो सुनाई दे रहा है सबको आवाज
Yes, sir.
आवाज
Audible,
सुनाई
sir.
दे रहा है हाथ उठाओ प्लीज आवाज सुनाई दे रहा है मेरा
हाँ तो उठाओ रे.
या थैंक यू थैंक यू थैंक यू थैंक यू गुड मॉर्निंग गुड मॉर्निंग पेपर दे पेपर और एक दे फटाफट मैं सर का अरे ये दे तांकर बायोडाटा दे प्रिंट कर दे Good morning, everyone. Good morning. Good morning, everyone. The session will start now. Praveen, can you? So, students, yeah, thank you. देखिए, as you will संग join करियो. Yes. Today, sorry for delay as there was some network issue. Okay. प्रवीण थोड़ा ये तुम्हारा कैमरा को घुमाओ और विंडो साइड में दिखाई नहीं दे रहा है नहीं ऑपोजिट डायरेक्शन ऑपोजिट ऑपोजिट ओके या और थोड़ा रिवर्स रिवर्स हाँ गुड थैंक यू Good morning, sir. Good morning, Dr. Shahid Hussain, sir. Sorry, there was some network issue, so we are late.
No worries
I
at all.
extremely
No
sorry
worries.
for that.
No worries at all. I was waiting for you. And
Yes,
just a
sir.
minute, I would like to share my first PowerPoint and then I will talk to you. Just a minute.
Sir, during this time, can I introduce you, sir?
Just a minute. Just a minute.
Yeah,
Because I
yeah,
would like to just
true.
confirm everything that whether everything is working or not.
Yeah.
Just a minute. Okay. Can you see this?
Yes, sir, it is visible, sir.
Okay, now go ahead.
Good morning, sir, and welcome to Danteshwari College of Pharmacy,
Good
Chhattisgarh.
morning.
Good morning. And on behalf of student, staff, and management, I heartily welcome you, sir. Sorry for delay, sir.
No worries at all.
It is my privilege to introduce you, sir. Sir is Dr. Syed Ahmed Hussain, sir. He is based at Calgary, Alberta, Canada. Sir is a dedicated and passionate educator with a strong commitment to cultivating a harmonious and productive learning environment. Learning over 3 decades of teaching expertise, adapted meticulous lesson planning, and adeptly forging meaningful connections with students and stakeholders alike, committed to the pursuit of a dynamic and captivating educational setting, fostering the growth of students into lifelong scholars and avid learners. Sir is a Canadian citizen and he has a proven track record in teaching and research capabilities in pharmacy with research papers published in various national and international journals. Demonstrated success in leadership roles, that is teaching, is into research and production manufacturing, which led to 80% of faculty growth. He has got a strong communication and interpersonal skills, oral and written, highlighted by exceptional group facilitation and presentation skills. He has got thorough knowledge and understanding of traditional and alternative therapies. Sir is detail oriented and well organized with the ability to manage changing priorities in order to consistently meet non negotiable deadlines. He is very fluent in English, Urdu, Hindi, and Punjabi. Sir's professional experiences. Sir is presently a professor and researcher, and he has prepared and delivered lectures and facilitated groups discussions in pharmacology and therapeutics using methods like problem and evidence based learning, as well as pharmacy practice, anesthesia, microbiology, anatomy and physiology, community pharmacy, institutional pharmacy, pharmacy math, sterile products, and message therapy. Sir has created case studies as a means of evaluating students during their residency period. He has administered and graded examinations, including action as an internal examiner for the medical doctor program for the classes of 96 to 2003. He has been, Sir is advised and supported students regarding course, academic matters, and career decisions. He has served on faculty committee addressing matters such as curriculum planning and degree requirements. Sir has coordinated and supervised a team analyzing the efficacy and costs of traditional drug therapies versus alternative herbal medical remedies. Consulted with the research and development department of numerous pharmaceutical companies using various pharmacokinetic techniques for drug development. Sir has also involved in the preclinical and clinical trials for new drugs prior to their approval. Sir has got hands-on experience on production and manufacturing also. He has directed a team of 35 in the entire production and manufacturing process. from raw materials to finished products. Sir has monitored and analyzed the manufacturing of aerosols, oral solid dosage form injections, and topical treatments, including Betnovet and Dermovet range. Sir is responsible for the setup, qualification, operation, and validation of all manufacturing and packaging equipments. Sir is a clinical pharmacist and he has verified prescriptions for proper dosage, dispensed pharmaceuticals, and counseled patients and other healthcare professionals on indications, contraindications, adverse effects, and interactions. Sir has compounded prescribed products by calculating, measuring, and mixing of drugs and other ingredients and filled appropriate containers with correct quantities. Sir has also updated and maintained medical profiles of patients, including a registry of poisons, narcotics, and controlled drugs. Sir has also ensured proper preparation, packaging, distribution, and storage of vaccines, serums, biologicals, and other drug pharmaceuticals. This is all about Sir and his employment histories. Sir is presently Royal Canadian Business College. He is professor of clinical medicines. And before that, Sir was with AGA Academy, Calgary, AB Canada. He is a professor clinical medical sciences. Before that, Sir was at GT College, professor of dermatology and physical sciences, NIWE, Canada Academy of Cosmetology and Messes Therapy, Calgary. He was professor, director of basic clinical medical sciences and clinical aesthetics. Prior to that, during 2018 and 2020, he was with Heritage College, Calgary, AB, that is again in Canada. He was pharmacy assistant program and MOA UC program professor of clinical medical sciences. During 2013 and 17, Sir was with Cambrooks College, Health Sciences, Calgary, and he was instructor of pharmacy practice and medical office assistant and masses therapy. And Sir is from 2013 to 2015, Sir was with ABM College, Faculty of Health Sciences, Calgary. He was instructor of pharmacy practice and messes therapy. Prior to that, Sir was with the CDI College. He was Faculty of Health Sciences, Calgary. He was instructor of clinical pharmacy. And he was also with Medicine Corner Pharmacy, Calgary AB. He was internal pharmacist. And prior to that, Sir was with Orbis Pharma Inc., Toronto. He was a research and regulatory associate. And during 2000 to 2004, Sir was with Frontier Medical College, Pakistan, professor and head of pharmacology. And during 1998 and 2000, Sir was with Hamdard University School of Medicine, Pakistan. He was assistant professor and HOD. Prior to that, he was with Ziauddin Medical University Medical College of Pakistan. He was assistant professor. And during 94 and 96, Sir was with Glaxo Wellcome, Pakistan. He was a production pharmacist. And he has started his career in 1990-91 with Aga Khan University Hospital, Karachi, Pakistan. He was a clinical pharmacist over there. Sir has completed his Doctor of Pharmacy, PharmD, University of Alberta, Edmonton, Alberta, Canada, on Messes Therapy Diploma, NIWE, Calgary AB. He was Medical Officer, Administration Diploma, Cambrooks College, Calgary AB. And during 2009, he has did his postgraduate diploma in clinical pharmacy and pharmacology, Calgary, Canada. And 2007, he was evaluating examination, pharmacy examining board of Canada. And during 2000, he has completed his master MPhil, clinical pharmacology and therapeutics, Hamdard University School of Medicine, Pakistan. And he did his bachelor of pharmacy from Faculty of Pharmacy, University of Karachi, Pakistan. So, and Sir is awarded and honored with as Best Performer Professor Awards from AGA Academy, Calgary, Canada in 2022, Heritage College, Calgary in 2020, ABM College Calgary in 2015, CDI College Calgary 2012, and he is member of following professional associations, that is Canadian Society of Pharmacology and Therapeutics. He is also a registered member of MTAA, that is Massage Therapy Association of Alberta during 2018, and he is also fellow of Royal Society of Health. So this is all about Dr. Syed Ahmed Hussain, sir. Thank you very much, sir, for giving us an opportunity to interact our students and our faculty members. So it is now over to you, sir.
Thank
Please.
you very much, Dr. Suriti. And it looks like that you are reading my second PhD thesis. It's a
Sure.
lot. It's a lot, and now I forgot what to say. Hello, dear beautiful students in India. I like India very much because without Indian songs, I cannot survive. And my language, Hindi, Urdu, everything. And I always start, if you don't mind, because my lecture is always not very, very serious lecture, because the lecture must be very like
Yeah.
happily lecture, funny type of the lectures. So I must say before starting anything, ऐ मेरे वतन के लोगों जरा आंख में भर लो पानी जो शहीद हुए हैं उनकी जरा याद करो कुर्बानी. Anyway, thank you very much. And I know many,
So
and I
nice of you, sir.
and I know many bhajans also. Yada yada hi dharmati ulani bhavati bharata. मैं पूरा पढ़ सकता हूँ, but I have a short time, and I would like to thank you that I have a lot of very talented and beautiful friends in Pakistan. Dr. Sweti, now you are my friend too. But I would like to very much thankful about Professor Dr. Saurabh Kose. He introduced me when he was at NIMS, and now we have a Dr. Junaid Tantre in NIMS too. And I have two very young PharmDs, and they have a great YouTube channel also, Dr. Nilesh Sharma and Dr. Pragya Pandey. And every day I think we talk about the cases and everything. So thank you very much. And all of you beautiful students are sitting here. So hello everyone, whether you are a D Pharm student, B Pharm student, Masters, PhD, or I think Pharm will start soon in your school. We normally say actually school. And when there will be a question answer session, it is up to you. You can ask in Hindi or Punjabi. I can understand very well, but I cannot speak good Punjabi. But I will reply to you definitely. So the topic I assigned to you is the pharmacist opportunities abroad, and this is my PowerPoint. I can share my PowerPoint to Professor Dr. Suruti. If you want, you can give it to your student. This is just for learning. And it is my 9:55 p.m. here at Calgary. We have a little chilly weather, -6 Celsius right now. We had a lot of snowfall, but normally our temperature is between -30 to -50 Celsius. So, but we survive because everything is heated, and I'm very passionate about teaching and learning. I just did my business administration also and accounting. So, pharmacists are all rounders. First of all, you must be proud that you want to be a pharmacist, whether you have a diploma holder, bachelor degree, or a doctorate degree, doctor of pharmacy, or a master's or a PhD, whatever you are doing. So you are doing great, by the way. Okay. And under the supervision of obviously Professor Dr. Suruti, he's a great and nice gentleman. So this is me. This is me without hairs. So if you want to research any medication for me, you can just do research so that I can grow my hair. Anyway, my name is Dr.
Let's hope for the best, sir.
That's right. So I'm Professor Dr. Syed I started my career as a Bachelor of Pharmacy degree. Then I did my MPhil Pharmacology PhD. You actually uh, told us lot, everything. And my final was the PharmD, and I'm a BCPS also, board certified pharmacotherapy specialist. And these are the institutions: AG Academy, Royal Business College, GD Navy, and the University of Calgary. I'm teaching in all these institutions of clinical medical sciences and pharmacotherapy. But when I was back home, I was professor of pharmacology and therapeutics. But in Canada, it is very important. You have to be very versatile. So I'm teaching anatomy, starting from anatomy to clinical medicine and pathology also, microbiology. There are so many disciplines. So the topic is about a pharmacist. What is the role of pharmacist in abroad? So definitely, I'm covering today North America. So in the North America, Canada and USA, I'm in Canada. I visited USA many times, and I know about the examination procedures also. And you all are welcome. Even if you are a diploma holder, pharmacist, so you must come as a pharmacy technician and write your exams. Or if you are a pharmacist, there's a great opportunity for every one of you. And I'm not saying that you cannot learn in India. You can learn a lot. We Asians, we are very, I must say that we are very hardworking people. I'm telling you, we are very hardworking as compared to whites. I hope any white will not listen my lecture, but we are very hardworking people. And I'm very helpful, as I told you. Still, I'm telling you the name, uh, Dr. Nilesh and Dr. Pragya and Dr. Suruti. I will introduce you later. And one of my friends from Pakistan, he just joined us, Dr. Santosh. He's also a PharmD and a clinical pharmacist. So welcome, Dr. Santosh, you too, and all of my great Indian friends. So this is the first slide. Why there is a rising demand for a pharmacy professional? The thing is that actually what happened, that multiple diseases, and we have the aging population. So you know that in the aging population, we have a polypharmacy all the time. There are different medications for the chronic conditions. And in Canada, we don't have many medical schools and we don't have many pharmacy schools. So we have a limited pharmacist and a huge salaries are for the pharmacist, because no one will give you medication except a pharmacist. You are the drug expert, not the medical doctors. Medical doctors have only physician samples they can give to the patient for 2 days, 3 days, or maximum a week. A patient has to come to a pharmacy to meet a pharmacist. Now, in a pharmacy, what is our team? Pharmacist is the head of the pharmacy, that is the king. I normally say the king because of huge salary too, and a huge salary and a drug expert. Then we have pharmacy technicians, which are also regulated. Very nice salary in pharmacy technicians also. So that's why I'm saying, if somebody is doing diploma in pharmacy, you have a great scope in Canada too. So please come and join as a pharmacy technician after writing our licensing exam. Then we have a pharmacy assistant also. So we have a team: pharmacist, pharmacy technician, and pharmacy assistant. Whether you are working in a community pharmacy or you are working in a hospital, short term or long term or whatever the facility. I normally do not read PowerPoint because I don't like to read PowerPoint. So this is a overview of the growing demand for a pharmacy professionals in Canada and obviously United States of America, our neighbor. So there is a current demand trend. Increasing demand for pharmacy professionals due to factors like an aging population, and I will explain it to you why. Expanded healthcare services and advancement in pharmaceuticals. You heard about a precision medicine. Now in future, every patient will have a different medication. So that is great. They are working on genetics a lot, a lot. And you know, my dear friends, my dear students, you are my friends now. Please improve your knowledge. Just improve your knowledge. Knowledge is a power. Whether you are studying pharmacognosy, pharmaceutics, pharmaceutical chemistry, I'm from clinical sciences, pharmacology and therapeutics, or whatever, you must be a knowledgeable pharmacist. So nobody can beat you. Here in Canada, we have a very good relationship with doctors and nurses. There is a triangle. Doctors, nurses, and pharmacists, we have a team. And within a pharmacy collaboration, we have a pharmacy technician and we have pharmacy assistant, which we all are working together as a team. Okay, so aging population, definitely they are aged now. They have multiple chronic conditions. And nowadays I'm saying that if you are not a diabetic, if you are not a hypertensive, you are not a normal person. So diabetes and high blood pressure or hypertension is common all over the world, just like epidemics. So the aging population is a polypharmacy. So to come to pharmacy is much easier. To see a pharmacist is much easier as compared to a family physician. Okay, one more thing. In Canada, there is a 8-year pharmacy program to PharmD. To become a PharmD, there is a 8-year program. There is no BS program anymore. After grade 12, our students first they will do 4-year BSc in medical sciences. But that 4-year BSc, they must have mathematics and biostatistics. Then they apply for 4 years, either pharmacy school or the medical school. Then another 4 more years. And after that, residency life, highly paid residency. So, expanded healthcare services, because I just told you that pharmacists are allowed to prescribe anything except narcotics. We are not allowed to prescribe narcotics in Canada. Only medical doctors, but everybody is accountable. In every province in Canada, we say province. In America, we say state. I'm in Alberta. Alberta is a beautiful mountain province. We have a blue mountains. So I normally say blue, like our veins has a purplish blue blood. So we have a blue mountain, which covered with snow all the time. And whether it is minus 30, minus 40, everybody enjoys here. So I was talking about expanded healthcare services. So yes, pharmacists can prescribe anything. We are giving injections, vaccinations, and all medication except narcotics. Okay. Narcotics are only allowed for medical doctors, and we have a triplicate prescription, 3-page prescription. Every province has a college. College, I'm not talking about like your college where you are working or where I'm teaching or university. That is not a college. College means a regulatory body. They will give our license for practice without a college, without a college in any province, whether it is Ontario, Alberta, Saskatchewan, any province of Canada or USA. We have a college. So college will provide us license. Without a college, we cannot do anything. Similar thing is for the doctors. We have a college of physician and surgeon. They control their doctors. For example, if one doctor is writing oxycodone, hydrocodone, or any narcotic morphine, so the college will ask, their college will ask that why you are writing so many narcotics. So everybody is accountable. And doctors are very good friends of pharmacy professionals. Whether you are a pharmacy technician, whether you are a pharmacy assistant, whether you are a pharmacist, PharmDs, we always say pharmacy professional. Nobody is superior, nobody is inferior. Everybody's work is different. But my dear friends, as I told you, in Canada, we work as a team. I am a professor, but when I work with my students, it's a very, very friendly class. It's a very, very friendly lecture all the time. And you guys are also very welcome. If Professor Suriti in future allow me for clinical lectures, I will be very, very happy to do with you clinical lecture with my two beautiful fellows in India, Dr. Nilesh Sharma, Dr. Pragya Pandey, and Dr. Junaid Tantre, and obviously under the supervision of Dr. Saurabh Kose and with Dr. Suriti too. Let's see. Now, expanded healthcare services. The expansion of continuous expansion of healthcare services, including clinics, community health centers, and specialized care facilities, contributes to the heightened demand for skilled pharmacy professionals. And Canada is welcoming. We are welcoming pharmacists, pharmacy technicians also. Then you have to write your licensing exam, which I will tell you later. Advancement in pharmaceutical is a lot. Every year, you will see that new medications are coming. And now, as I told you, precision medicine, one of my uh, very expert oncology pharmacist, Dr. Mohammed Nabil, is also, I can see right now. He is the oncology pharmacist. He's coming to Canada very soon, and he is expert in precision medicine too. Maybe you can talk to him later in the question answer session. Aging population, I already discussed with you. And I am sorry if you think that I am just speaking like a fast speed Japan train. You can tell me, I will come down because the time is short actually, so I have to speak. Are you guys understanding, my dear fellows? Can you say something? बच्चों आप लोगों को बात समझ में आ रही है?
Yes, sir. Yes, sir.
चले 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 डॉक्टर सुनीति ने तो यस कर कह ही दिया. वैसे आप मुझे सरमत कहा करें, डॉक्टर सैयद कहा करें आप मुझे. अच्छा जी, चलें. और ये अमृत कुमार साहब भी कोई सुन रहे हैं और बहुत सारे बच्चों को मैं स्टूडेंट्स को देख रहा हूँ सामने. एंड और स्टूडेंट्स मैं आपको बताऊं, आप ही की वजह से हम लोग पढ़ते भी हैं. आपको पढ़ाने के लिए हम लोग पढ़ते हैं और पढ़ाई और फार्मेसी मेडिकल एक ऐसा प्रोफेशन है कि जिंदगी भर आपको पढ़ना पड़ता है. आपको जर्नल्स पढ़ने पड़ते हैं बिकॉज नॉलेज, अगर आप में नॉलेज है आपको कोई नहीं बिठा सकता, चाहे वो मेडिकल डॉक्टर हो, एक्सपर्ट मेडिकल डॉक्टर्स हो, सर्जन हो, whoever. You are the expert or you are the custodian or the drug therapy. Okay, now this is the statistics slide and I have to wear my glasses actually. So in Canada, the first point is the percentage of vacant pharmacy positions, 10%. In USA, it is 12%. Patient needs unmet due to workforce shortage, 15%. So we need a lot of pharmacists. We need a lot of pharmacists, whether in the field of community, hospital, or academics. That I will discuss with you later, or research. Okay. Projected growth in demand versus availability workforce, 20%. Overall demand versus workforce, 45% for Canada and 52% for USA. But that is all statistics, and I am not very good in statistics. Just this is a figure for you guys. Now, overview of the growing demand for pharmacy professionals in Canada and USA. Impact on healthcare system, addressing the efficiency and effectiveness challenge. Number one, delayed patient care because of the shortage. Because of the shortage of pharmacists and doctors. So that's why I'm motivating all of you. Please work out and work hard and please try to come to Canada also, try to visit Canada, and you can also pay back to India also because you are studying in India. Increase workload. A lot of workload for a pharmacist, because pharmacists are working just like a medical doctors. Every community pharmacy has a room, consultation room, where pharmacists will sit and talk to the patient. Otherwise, pharmacy assistant can receive a prescription, pharmacy technician can prepare everything, but final decision is a pharmacist decision. Whether to dispense the medication or not. And one thing I'm telling you, my dear friend, if you dispense the medication from a pharmacy, from the pharmacist's signature, and anything has happened to the patient, so in the court, pharmacist will go, medical doctor will not go. Because we are the final check. And you are lucky that your professors are experts, and we are also lucky that we are very hardworking. The teachers also are very hardworking to teach you very well and very up-to-date knowledge. Now, so there must be an increased workload. So that's why pharmacists are very welcome, whether for a community or any other thing. Medication errors, to reduce the medication errors. Although we have a very good system here, we have a DIN number, and then that is all detailed thing. Maybe in some other lecture, I will cover all those aspects. Impact on chronic disease management. Side by side, I have to drink my caffeine tea because I have to stimulate my sympathetic nervous system. Okay. So impact on chronic disease management. A shortage. A shortage can hinder effective management of chronic diseases as patients face challenges assessing necessary medications and consultation services. As I just mentioned to you, that pharmacists are clinical pharmacists. Okay. In Canada and USA, whenever we say pharmacist, we mean a clinical pharmacist. We don't mean industrial pharmacist. But I know that from India and other parts of the world, you guys are joined industry also. That is also very important portion because when you are in a manufacturing, I starting my career and in a manufacturing. I worked 5 years with DSK in production, quality control, quality assurance, little bit of pharmacy marketing. Then I entered into hospital and a teaching profession. Because I love teaching, that's why I'm in teaching, but I'm associated with a clinical pharmacy all the time. Okay. Economic consequences. The inefficiencies resulting from the shortage can have economic implications, including increased healthcare costs and potential strain on public health resources. And nowadays, the last point is very, very important. Importance of the robust pharmacy workforce. In our University of Calgary, we have a 5 teaching hospital, and the biggest hospital is a Foothill Hospital. Very first time in our own oncology. In our oncology, we have a very big oncology, and we have a research center for oncology too. So we are placing robots for compounding, for a bulk compounding. So robots will do the compounding, but humans are always there. So don't worry, we will be there with the robots. Now, this is the licensing requirement for a Canada and a USA. When you move to Canada, you have to evaluate your degrees from the Pharmacy Examining Board of Canada. First, you have to write your evaluating exam. After that, you have to write all those exams, which Canadian pharmacists, when they graduate, they will write. Like in Canada, we say qualifying exam. In America, we have the North American Pharmacist Licensure Exam, NAPLEX. And in Canada and America, we have the bridging programs. And why government open bridging programs when you move from Canada or any part of the world? Then to up to the level of a clinical sciences. Because definitely, I'm not saying that your curriculum is old or something like that, because we are in a clinical pharmacy, so we teach more clinical. So I have a lot of clinical pharmacists from India. They are practicing, they have their own pharmacies, so they are all successful. So we have a bridging program to educate international pharmacy graduates so that you can learn more and more Canadian system or the US system, and the hands-on clinical experience. How to how to manage a patient, because treatment is not a good word. First of all, how to manage, how you will manage a patient. So we will teach you and all the regulatory compliance also. What is our regulatory activities in Canada and in USA. Then this is all the accreditation processes. We will teach you all the case studies and the cases. We have a very good pharmacotherapy books like a DPRO and applied therapeutics, and you heard about that. And I hope that you are reading those books also. I'm not going into too much detail on my PowerPoint because I like question answer session. Just I want to do this slide with you. These are the unlocking pathways to professional successes. Community pharmacy first, then hospital is a very big area. For the hospital pharmacy, we say it is a universal pharmacy. When one is a centralized unit, then we have a satellite for every specialty, whether it is oncology, pediatrics, geriatrics, or whatever is the specialty area, whether the medical specialties or the surgical specialties. Yes, research and development, you can join, or pharmaceutical industry. Uh, Unfortunately, our 99% of the pharmacists who graduate from America or Canada, they are clinical pharmacists, so they join hospital or a community pharmacy. Government and public health, definitely. I'm in academia also, teaching for various level for the MD program, PharmD, and the technician level programs also. Entrepreneurship. You can open your own pharmacies or continuing education and different specialization. We have the fellowships programs also here. Job market is very good. I'm not going into detail of this thing. I know the time is short. Now, thank you very much. And I would like if you guys have any questions, please. You are very welcome to any questions. And but before a question, I would like to introduce one of my friend here, Dr. Santosh Kumar. You are very welcome, and thank you very much. You joined the session, and Dr. Nilesh Sharma, Dr. Pragya Pandey, Dr. Mohammad Nabil. He is the oncology pharmacist, and obviously all of my great students from the Dentistry College and under the supervision of Dr. Suruti. So please go ahead, whether in Hindi or English, whatever you like. वैसे मेरी आवाज काफी बैठी हुई है, मैं इतना अच्छा बोल नहीं सका हूँ क्योंकि मॉर्निंग से मेरा ये चौथा लेक्चर है इस वक्त और रात के 10:20 हो रहे हैं हमारे यहाँ. तो बट गो अहेड प्लीज. Or any comment? Or Dr. Mohammad Nabil, if you can tell us about precision medicine. If you can unmute your mic, you are very welcome to say about the
Good.
precision medicine to our beautiful students are sitting here.
Good morning, Mohammad Nabil, sir. You are welcome to Danteswari College of Pharmacy, sir. Kindly speak few words and address our students and staff.
Yes, Dr. Nabil, please introduce yourself.
Please, sir.
And please go ahead.
Thank you. First of all, thank you so much for inviting me. Thanks a lot to Dr. Said as well and rest of the all organizing team as well. So my name is Muhammad Nabil. I'm an oncology pharmacist in Cancer Care Hospital. I am just working on a Persian medicine right now. So Persian medicine is the advancement in the medicine, like the traditional medicines, where is the no any people's like in which there are no any peoples and just getting the medicines without discrimination of their genetical testing, the next generation sequencings, and the rest of the test. While we are talking about a Persian medicine, we are just analysis what's the gene is defected, and we can just check their next generation sequencing and also the gene profiling as well of the patient. After getting all the scenario, will personalized healthcare services to provided by interpersonal activities with the pharmacist, with the physicians and the nurse as well. So then we can deal the patients on a genetical level, where the side effect is very minimized, like a 90% reduction of the side effects of the any medicine. Like while you are dealing with the oncology medicine and anti-neoplastic medicines, there are a lot of the it's a number of the side effect list. Like you can say the greatest side effect is the myelosuppression, and due to myelosuppression the cancer patient is suffering a lot. So we are targeting the precision medicine. While we are dealing with the precision medicines, we can personalize with the antimicrobial resistance reductions. We can check their cardiovascular medicines that are producing a lot of side effects, and we can minimize with the help of the personalized treatment.
That's
So
great, Dr. Mohammed Nabil, and I'm welcoming you to Canada soon. You know that you are coming to Canada to
yeah,
contribute
yeah,
with us
thank you
also.
so much, thanks a
And
lot.
and you are very welcome because I have a beautiful friend from India. So, Dr. Suruchi, with your permission, if you allow me, can I have a two beautiful a man and a lady from National Institute of Medical Sciences, Jaipur, Pragya Pandey and Nilesh Sharma. Pragya, can you please, and Nilesh, can you say a few words about
Please,
your
sir. Please, sir. Welcome, Dr. Pragya and Nilesh, sir. Please address our
Please
students,
go
sir.
ahead. And why don't you open
Please.
your cameras? Why are you shy? You talk to me every day.
Thank you so much,
Thank you
sir.
so
Thank
much,
you so
sir.
much, Sayyid sir. We
Open
are
your camera,
in
please.
hospital right now, so that's
Oh,
why we
you
are
are
not
in
opening our cameras.
Okay, okay,
Okay.
okay.
And we both have a YouTube channel named DRS Vlogs, and we post daily life vlogs of PharmD, pharmacy, what are the difficulties, and
And
so
also
many
our
things.
internship journey also. So you guys can go and check it out. And thank you so much, sir, for introducing us.
No, no, you are very welcome. And Dr. Turiti, what happened that always teacher learn from the students also. They are very talented, and I know that your
Yes,
students
sir.
are very talented too.
Yes, sir.
So,
Yes, sir. New
so
generation is very talented,
very
and we need
talented.
to learn. You need to
And
learn from them.
And I'm very scared when sometimes Dr. Nilesh or Dr. Pragya ask me a clinical question. I said I have to check my reference first. Then I will answer. Okay.
Yes, sir.
So
Yes,
please
sir.
welcome, please your students, please. Anyone? And I can
Any
see
questions, please, from
Mr.
student side?
Amrit Kumar. I don't know, Rat something.
Rat, yeah.
Rat, if you are a student or a teacher, I don't know.
Yeah,
So
he's a
anybody?
two, sir. Yeah. Deepak, you can ask.
Good
Deepak
morning,
और
sir.
Kumar.
बेटे और आप
Or
Good
बेटे
morning,
मैं
sir.
Sir, good
मैं
morning.
मैं तो
Sir, good
हिंदी
morning, sir.
गुड मॉर्निंग
please.
Sir,
डॉक्टर महेंद्र
yes, sir. We are very much fortunate that after getting your the vividly the deliberations, our students and the staff has been highly benefited, sir. For the
anytime
B Farm students and M Farm, yes, sir. For B Farm and M Farm students, what are the scopes at Canada, sir, for appointment?
जी जी देखिए मैं आपको बताता हूँ हालांकि कनाडा और यूएसए में अब फॉर्म डी होता है बीएफ नहीं होता या बी फॉर्म नहीं होता लेकिन अभी भी हम आउटसाइड कनाडा से इमिग्रेशन पे बी फॉर्म वालों को लेते हैं और वो भी उसी तरह फार्मासिस्ट बनते हैं जिस तरह फॉर्म डी वाले बनते हैं लेकिन मैं एक आपको सजेस्ट करूंगा दो चीजें खाली एक तो ये कि अगर तो आप लोग फॉर्म डी स्टार्ट कर सकते हैं तो जरूर करें दूसरा एक बहुत इंपॉर्टेंट एस्पेक्ट है कि पूरे कनाडा में फार्मासिस्ट का लाइसेंसिंग एग्जाम होना चाहिए उसके बाद उनको प्रैक्टिस की इजाजत होनी चाहिए आप कैसे वैलिडेट करते हैं आपके यहाँ तो हजारों फार्मेसी स्कूल्स हैं यू हैव टू बी वैलिडेट इसी तरह कनाडा अमेरिका यूके ऑस्ट्रेलिया कोई फार्मासिस्ट प्रैक्टिस नहीं कर सकता या कोई डॉक्टर विदाउट पासिंग द लाइसेंसिंग एग्जाम So it is very, very important. If you need my help and anything, I can provide you, I can help you for anything. But this is my suggestion for you that licensing exams are very important for India too.
Sir, thank you, sir.
Anyone else,
Thank you, sir,
please?
for your kind
Anyone
information.
else? Anyone?
Good morning,
Yeah,
sir.
please anyone.
Yeah, Rahul, please say.
Good morning, sir.
And
Myself, Rahul Dubey from B Pharmacy
Good morning,
11th
sir.
SEM in Danteshwari
hello,
College of
Rahul,
Pharmacy.
how are you?
Am I audible, sir?
Yeah, yeah.
Swastik, please.
Bhai, aap-
Swastik, please mute your mic because Rahul is speaking. Once
Good morning,
somebody is
sir.
speaking, you are not supposed to speak. After Rahul
First of
completes
all,
his question, then only you
फर्स्ट
should
ऑफ
speak.
ऑल आप लोगों ने अपने कैमरे क्यों बंद किए हुए मुझे तो समझ नहीं आ रहा मैं भी बंद कर लूं कैमरा हेलो ओके गो अहेड राहुल
Sir, myself Rahul Dubey from B Pharmacy 7th semester in the Danteswari
वाओ
College of
वेरी गुड
Pharmacy. First of
एक्सीलेंट
all, we all hearing you, sir.
सॉरी आई कांट हियर यू
Am I
कैन यू
audible, sir?
से इट अगेन
Am I audible, sir?
यस
Yeah,
यस
you are audible. Please speak.
First
या
of all,
यू
we
आर
all feel very happy and motivated after hearing you, sir.
वेरी वेलकम
Sir, my
यू आर
question
वेरी
is,
वेरी वेलकम एनी टाइम
which country need more pharmacists? Because after listening to you, I also feel like going abroad.
देखिए as compared to USA, Canada is little easy to come for immigration purpose. And after that, you will get your license after you have to pass all the exams. But always I suggest, still I am telling you, you have to improve your clinical sciences because in Canada, we all are clinical pharmacists. There is no industrial pharmacist at all. I'm not saying that pharmaceutics is not important or medicinal chemistry is not important, but pharmacotherapy, because in Canada, you have to deal with patients. तो पेशेंट्स के लिए आपको कौन से सब्जेक्ट चाहिए आपको क्लिनिकल सब्जेक्ट चाहिए आप लैब रिपोर्ट्स में बड़े अच्छे होने चाहिए इंटरप्रिटेशन ऑफ द लैब्स एंड पैथोलॉजिकल रेडियोलॉजिकल आप ईसीजी के बारे में सीखिए हाउ टू रीड ईसीजी एंड ऑल अबाउट फार्माकोलॉजी तो है ही खैर फार्माकोलॉजी एंड फार्माकोथेरेपी देखिए वन मोर थिंग फार्माकोलॉजी की बेस पे आप किसी का ट्रीटमेंट नहीं कर सकते जब तक आपने फार्माकोथेरेपी ना पढ़ी हुई हो तो वी हैव द बुक्स अप्लाइड थेराप्यूटिक्स और वी हैव अ बुक ऑफ डिपीरो एंड इफ यू वांट गाइस यू कैन Dr. Pragya, Dr. Nilesh can also help you because we have all this stuff, all the clinical cases. So try to be more and more clinical. Although I know that your teachers are very expert, your professors, they can help you, and I can help you anytime. And Dr. Suriti will provide my email, and
Sure,
and you
sure.
guys are all very welcome.
Sure,
Thank you,
sir.
sir. Thank you so much.
Swastik, please ask your question.
Okay.
And
Good
open
morning,
your
sir.
Good
video.
morning, Pratik. Yes, go ahead.
Yes, sir. So my question is, sir, what are the countries are there that are they're providing more opportunities and more, the career guidance for the pharmacists?
Can you repeat your question, please? What are the countries?
So what are the countries are there which is the providing the more opportunities for us, and what would be the better option for choosing the pharmacy profession in for abroad?
Your question is excellent, by the way. यह
Yes,
आपका
sir.
बहुत अच्छा क्वेश्चन है देखिए कनाडा खाली पड़ा है कनाडा इतना बड़ा मुल्क है हमारे पास तो इतनी गुंजाइश है कि हम आधे से ज्यादा इंडिया को भी संभालें अपने अंदर अमेरिका में फैसिलिटीज इस लिहाज से कम है क्योंकि अमेरिका इज हाईली पॉपुलेटेड ऑल दो हमारा तो वो नेबर कंट्री है लेकिन आप कनाडा में आइए बड़े फ्रेंडली लोग आपको मिलेंगे बहुत गाइडेंस है वी हैव द ब्रिजिंग प्रोग्राम टू अपग्रेड यू अप टू द लेवल ऑफ अ कैनेडियन फार्मासिस्ट मैं ये नहीं कह रहा बिल्कुल कि आपका कोई लेवल कम है बट बिकॉज क्लिनिकल साइंसेस के अंदर वी आर आई थिंक बेटर बिकॉज दी एक तो मैंने पहले बताया कि 8 साल लगते हैं फार्मासिस्ट बनने में तो डेफिनेटली दे स्टडी मोर I did my PharmD later after my doctorate degree. I am a pharmacologist also. I am researcher also. So welcome to Canada. और कनाडा मेरा ख्याल में बहुत ज्यादा वेलकम करता है और आप जरूर आइए और अगर आपको किसी के YouTube के चैनल से देखना है तो वो ये दोनों डॉक्टर हजरात जो यहाँ हैं डॉक्टर नीलेश और डॉक्टर प्रज्ञा ने आपको बताया आपके बारे में डॉक्टर संतोष why are you so quiet? You are my very good and great friend. Can you say something?
Sorry, sir. I have a small doubt. So, is it Canada is better than the Australia, sir?
देखें, हमारे पास काफी लोग ऑस्ट्रेलिया से कनाडा मूव हुए हैं। मैं ऑस्ट्रेलिया में नहीं रहा हुआ हूँ। ऑस्ट्रेलिया भी अच्छा होगा, नो डाउट अबाउट इट, लेकिन कनाडा देखें, कनाडा में बहुत स्कोप है और हमारे पास बहुत ज्यादा स्पेशलाइजेशन हैं एज कम्पेयर टू ऑस्ट्रेलिया। वी आर क्लिनिकली much better than Australia and UK too. I'm telling you this thing. It is not because I'm in Canada, I have to tell you like that. But whatever the opportunity, you can grab that opportunity. अगर आप ऑस्ट्रेलिया को आपको आसान लग रहा है तो आप ऑस्ट्रेलिया देखें, आप बाद में कनाडा आए या मत आए कनाडा, वो आपकी मर्जी है। So whatever you like.
Thank you, sir. So,
Yes,
my another
yes,
question is.
Kanu. Swastik, please mute your mic. Kanu, please. Two more people
Yes,
are
sir.
there. Deepak and Kanu, please speak.
Good morning, sir.
Good morning. How are you, Kanu?
Myself, Kanu Charan Panigrai, student of B Farm. My question is, how much salary a fresher can get after degree and diploma in India, sir?
In India or
In
Canada?
India or in Canada?
In
Canada
Canada,
and
sir.
USA. Okay.
अच्छा, ओके। देखिए, मैं आपको
Good
बताऊं,
question, sir.
very good question. Yeah, very, very important. Money is always important. And I'm very happy when my wallet is full with money. Okay. So, Mr. Kanu, the thing is that for a pharmacist, it is a range from $55 to $65 an hour because that is an hour base. 40 hours a week is a job. It's a huge money. And for a pharmacy technician, they are also regulated from $30 to $35 an hour. And pharmacy profession, I'm telling you, is a white collar profession. और ये मैं नहीं कह रहा हूं, आप पूरी स्टैटिस्टिक्स उठा के देखिए, मेडिकल प्रोफेशन की उतनी तारीफ नहीं की जाती जितने ज्यादा अप्रिशिएट फार्मेसी प्रोफेशन को करते हैं। एंड वी आर ऑलवेज रेडी फॉर आवर पेशेंट्स, आवर एंड आवर कस्टमर्स, बिकॉज होता ये है कि साइकेट्रिक पेशेंट्स को अमूमन हम पेशेंट्स नहीं कहते हैं, कस्टमर्स कहते हैं, क्योंकि वो जरा माइंड करते हैं, वो राइट अवे कहते हैं वी आर नॉट पेशेंट्स, वी आर कस्टमर्स ओनली। सो दैट्स व्हाई हूएवर, सो वी मैनेज। तो जी बहुत अच्छी सैलरी होती है और आप फौरी आइए और आते ही आप यहाँ पे ऑडी खरीदिएगा आके ही।
Thank you, sir. Thank you. Kanu, it is approximately 1,20,000 Indian rupee per week.
Yes, sir. Yes.
Yeah, I think so, maybe.
Yeah, Deepak, please ask your question.
So who is Deepak?
Yes, sir. Good morning, sir.
Good
My name is
morning.
Deepak Kumar. I'm student of B Pharmacy. My
Is it-
question is, to
Deepak-
work in USA or Canada, what are the things to be taken care of?
आप जरा दोबारा पूछिए, मैं कुछ जोक करने वाला था तो मैंने कहा कि मैं आपको दीपक कुमार के बजाय मैं आपको किशोर कुमार कह दूं, माय फेवरेट सिंगर।
So we need to listen a song also, sir.
रिपीट करें क्वेश्चन अपना, दीपक।
Yes, sir. Sir, to work in USA or Canada, what are the things to be taken care of?
You have to improve your clinical subject. देखिए, अगर आप एनाटॉमी भी पढ़ते हैं तो क्लिनिकल एनाटॉमी, पेशेंट फोकस्ड। अगर आप क्लेविकल के बारे में भी पढ़ रहे हैं तो आपको फिर फ्रैक्चर्स के बारे में पता होना चाहिए। अगर आप कोई भी चीज पढ़ते हैं, फार्माकोग्नोसी भी आपकी क्लिनिकली बेस्ड होनी चाहिए। हर्बल मेडिसिन, अव्वल हमारे यहाँ फार्माकोग्नोसी नहीं पढ़ाई जाती, अमेरिका में और कनाडा के अंदर हमारे यहाँ हर्बल मेडिसिन का सेमेस्टर होता है, लेकिन वो भी इट इज अ वेरी क्लिनिकल फॉर द क्रॉनिक कंडीशन बट नॉट फॉर द एक्यूट कंडीशन। जाहिर है एक्यूट कंडीशन में हार्ट अटैक का पेशेंट है, मायोकार्डियल इंफार्क्शन है, आप उसको किसी अंगूर का या जामुन का तो इंजेक्शन लगाने से रहे। तो herbal medicine is also very important, but pharmacognosy, this is my request to the Indian institutions and other institutions outside India, please teach pharmacognosy more clinically, not just a pharmacognosy. You must be patient focused. अगर आप हर्बल मेडिसिन पढ़ाते हैं तो हर्बल मेडिसिन भी पेशेंट फोकस्ड होनी चाहिए। ओके, एनी अदर क्वेश्चन प्लीज?
Thank you, sir.
You are very welcome, Deepak. Or Dr. Suruti is here. So kindly, Dr. Suruti, you can share my email address and I'm very happy to to guide your students anytime.
Thank you, sir. Thank you. Thank you very much, sir.
Or anytime if you want any clinical lectures, because I'm not saying that I'm expert in clinical lectures, but I like clinical medicine, so I'm teaching all DPO and applied therapeutics and all the cases.
Thank you, sir. Thank you
Good
very much
evening,
for
all of
giving
us.
your
Good evening.
time and all.
Now Dr. Santosh is here.
Yeah, Dr. Santosh, you are most welcome. Please,
Sorry, sir,
speak
to
few words
interrupt
to
you.
our students.
You may continue. You may continue.
No,
Okay,
Dr. Santosh, after that I will continue. Please address our students.
Thank you, sir.
Thank you
Thank
for
you so
coming,
much.
sir.
Thank you, Dr. Said, to introduce me. It's a lot for me. I am really great to see you after a long time.
And I will meet you in December very soon.
Thank
After
We will meet. We will
I
meet,
will meet
inshallah,
you.
sir. We will meet.
I will meet you in December too. And thank you very much, Santosh. And thank you very, very much. My beautiful students are sitting. Some are in their white coats. एक तो white coat को आप लोग lab coat मत कहा करें, देखिए lab coat जो है ना, थोड़ी सी तौहीन है कहना ये lab coat. ये आपके it is a pride. व्हाइट कोट सेरेमनी होती है हमारे यहाँ फर्स्ट ईयर फार्मेसी की भी, तो व्हाइट कोट क्या करें, दैट इज योर प्रोफेशनल व्हाइट कोट. ओके, एनी अदर क्वेश्चन? और डॉक्टर अमृत कुमार क्या बैठे हुए, ये पढ़ते हैं या पढ़ाते हैं मुझे नहीं पता.
Yeah, he's one of our faculty, sir, and he
wow.
is coordinating all these activities.
Hello, Dr. Amrit, how are you? कैसे हैं आप?
It's a very nice session, sir. Nice to hear you, sir.
आपका बहुत शुक्रिया. और मुझे तो फार्मा को थेरेपी के साथ साथ अंताक्षरी खेलनी बड़ी अच्छी आती है.
Once we will definitely do this, sir. And sir, I have carefully noted down that along with Dr. Saurabh Kose, your good self, along with Mohammed Nabil sir, Dr. Pragya Pandey, Dr. Santosh Kumar, and Dr. Nilesh, we would like to have a physical session in our institution.
Okay. I would like to say, Dr. Suriti, one thing. देखें सोशल मीडिया का फायदा कैसा होता है, मैं आपको बताऊं. मैं डॉक्टर नीलेश से और डॉक्टर प्रज्ञा से सोशल मीडिया पे मिला, और ये यूट्यूब के मैं इनका चैनल देखता था, बड़ा अच्छा लगता था मुझे, तो मैंने इनको टेक्स्ट करना शुरू किया. तो पहले तो उन्होंने जवाब दे दिया, उन्होंने कहा who is that stupid guy to text me. And long story short, now we are very good friends, and hopefully he will visit soon to Canada, and they are very very great and very मैं क्या कहूँ उनके बारे में, दोनों बच्चे बहुत अच्छे हैं, बहुत ही टैलेंटेड, एंड आई एम प्राउड ऑफ इंडिया कि आप लोग इतने अच्छे बच्चों को ट्रेन करते हैं. एंड मेरी किसी चीज में आपकी जरूरत हो, कोई आपको पीडीएफ वर्जन चाहिए, कोई आपको ऑडियो विजुअल चाहिए, जस्ट लेट मी नो.
Sir, I would love to see my students working in Canada and the USA with your guidance, sir.
Yeah,
so that will be the D-Day for me when my students will work in USA and Canada under your guidance. Thank you very much, sir, for coming. Let me complete the official vote of thanks. And sir, thank you very much for coming and delivering such a wonderful and interactive session. So that is what students need. And next time we noted that when you will physically be here, we will definitely play Antakshari also. And thank you very much for connecting Dr. Santosh, Dr. Mohammed Nabil sir, Dr. Pragya Pandey, and Dr. Nilesh to Danteshwari College of Pharmacy.
And Dr. Junaid is not here right now. Otherwise, Dr. Junaid is the assistant professor of pharmacology at NIMS also. He's a great guy. और मेरी पहली बुक इंडिया से पब्लिश हो रही है, अगले हफ्ते आ जाएगी, फार्माकोलॉजी फॉर मेडिकल ग्रेजुएट.
So nice of you, sir.
और मैं आपको भी
congratulations, sir.
और आपको भी मैं वो बुक भेजूंगा. अदरवाइज मैं 5 बुक्स का ऑथर हूँ ऑर्थोपेडिक मेडिसिन के अंदर ऑल्सो.
Thank you, sir. Thank you very much. Thank you very much, sir.
Have a great day.
Again, I thank you on behalf of our student, staff, and management. Thank you, sir. Hope we will be interacting on social media till we meet physically.
Okay,
thank you,
take
sir.
care.
Thank
Bye-bye.
you,
Take care. Thank you very much.
And this is a small certificate of appreciation, sir. It is on electronic media. The physical
बिल्कुल
copy I will
बिल्कुल
be sending you by post.
आप मुझे
Thank you,
करें,
sir.
मैं कल ही फ्रेम करके अपने ऑफिस में इसको लगाऊंगा. थैंक यू
So
वेरी मच.
nice of you, sir. Thank you, thank you,
Take
thank you.
care. Bye
Thanks a
bye.
lot, sir. Thank
Bye
you.
bye. Take
Bye
care,
bye.
everyone.
Bye bye. Bye bye. Bye.
Thank you, sir.
Thank you.
Bye bye. Thank you, sir.
Thank you, Santosh. Thank you, Nabil. Thank you, JD, and so many other beautiful students
Thank you
are
all.
here. And
Thank you
thank
all.
you, Dr. Chiruti.
Yeah.
Thank you so much. Bye
Thank
bye.
you, sir. Thank you, sir. Bye bye.
Bye.
Bye bye, sir. Thank you. Good day, sir. Yeah. My dear students, the next we have another guest from Australia, and we will meet right at 11:30. And he is Dr. Shrikant Dhumal, who has got two analysis labs in Australia. He has started, and both the labs are very unique and very important labs of Australia. Also, he has got a manufacturing unit around 11:30. He will join, and he will show you his labs. So be attentive. वो लैब के सारे कैसे होता है एक एनालिसिस लैब वो दिखाएंगे आपको. बहुत सारे इंस्ट्रूमेंट जो आज तक आप देखे नहीं है, all sophisticated instruments he will show to you, and आपको समझाएंगे कि दवाइयाँ कैसे एनालिसिस किया जाता है, कैसे उनके गुणवत्ता के बारे में जो टेस्टिंग हम लोग करते हैं वो दिखाएंगे. जैसे डॉक्टर कलाई सलवन वाज सेइंग यस्टरडे कि हम लोग टैबलेट अगर है तो डिसोल्यूशन इज मस्ट, इंजेक्शन अगर है तो स्टेरिलिटी टेस्ट इज मस्ट. सो इंडियन फार्माकोपिया के थ्रू से वो ये होता है. इंडियन में जितने भी मेडिसिन बनते हैं दैट हैज टू बी सर्टिफाइड बाय इंडियन फार्माकोपियल कमीशन. सो सिमिलरली डॉक्टर धूमल विल शो यू ऑल द ऑल सारे उनके एनालिसिस लैब दिखाएंगे. Now he will join exactly at 11:30. So I can request Praveen to play some music and all for the entertainment of students, and few of our students who are supposed to sing, if they can continue this for another 20 minutes. So right at 11:30, Dr. Dhumal, Shrikant Dhumal will join from Australia, and he will tell you how the analysis are being done, and he will show you his lab. So this is an opportunity for you to see an analytical lab. Okay. Thank you, dear friends. Thanks a lot. Yeah, dear friends, particularly final year students, those who have oral presentations, those who have submitted abstract and all, only they can come to first floor and meet Amrita ma'am. Only those who are having oral presentations. Okay, thank you.